Hi everybody, this is a video about treating mold toxicity slash mold illness. Somebody posted a comment or made a comment on one of my recent videos just asking about how I treat mold or how can mold be treated. And it's been a little while since I posted a video about the approach that I use, so I thought it was a good time to post another one. So just before I get into the nuts and bolts of the video here, as a reminder, nothing I say should be construed as medical advice. This is for informational purposes only. Please talk to your own clinician about your healthcare needs. So when it comes to treating mold in my practice, I use there's sort of three components to the treatment that I feel are important. So one is that we need to make sure that we're killing off the mold. If a person has been in a moldy environment and mold has had the opportunity to colonize the sinuses, whether that patient's still in the moldy environment or not, we need to treat the sinuses in many cases. The question that was asked on this topic was specifically around someone who had been in a moldy environment, maybe I think like 15 years ago or something like that, but still has symptoms. So in a case like that, they're not being exposed to mold toxins anymore, but those from an external source, but the mold toxins may be growing from inside of them from mold on their sinuses. So sinuses need to be treated. In my practice, I typically use essential oil nasal spray. Dr. Jill Christa, another naturopathic doctor, she has really great resources about this. She talks about it in her book. It's called Breaking the Mold. For any clinicians who might be listening to this video, she has an amazing clinician training course, which I can't recommend enough. As I've mentioned in passing a couple of times here in my videos, I've recently started a podcast called the Overcoming Chronic Illness Podcast. I actually interviewed Dr. Christa 2 weeks ago or so. The episode hasn't launched yet, but anyways, please stay tuned for that. She's been on many other podcasts as well. You can get your fill of Dr. Christa out there on many different interviews. But I interviewed her myself, and we had a great conversation. And so please check out that interview when it launches, and I'll make an announcement about that when it's going to be launched. So treating the sinuses, again, essential oil nasal spray, kind of the backbone of that. And then at a certain point, oftentimes we'll wind up switching that over to a biofilm disrupting nasal spray to make sure we get rid of all the nooks and crannies that the mold might be hiding in. The second principle of treatment in my practice is making sure that we're supporting the pathways of detoxification in the body. So really important to make sure that the liver and the kidneys are not being thrown to the wolves when we're hauling out mycotoxins, particularly supporting the liver. Once the mold toxins get released by the mold, get into the bloodstream, the toxins are brought to the liver, and the liver is supposed to break them down. That requires certain resources to undergo phase 1 and phase 2 detoxifications of that mold. So really important to make sure we have B vitamins, certain minerals and trace minerals in place to work with that support. I know a good question is, like, what do I take, what dosages? And of course you have to talk to your own healthcare provider about that, because I can't give medical advice over social media. But those are some of the nutrients that are important. And then also glutathione, the strongest antioxidant in the human body, very important for mycotoxin elimination. So that's something that's oftentimes a helpful supplement in my patient population. And then the third component of treatment when it comes to treating the mold itself is making sure we have a binder in place. So I like activated charcoal. That's my favorite. Some clinicians like to match the mycotoxin that's present in the body as determined by a urine mycotoxin test to certain binders. Some mycotoxins, at least in petri dishes, are better at being bound up by activated charcoal. Others are better at being bound up by clay. Some might be better getting bound up by chlorella or Saccharomyces boulardii or other things like that. In my experience, I like good old charcoal. It seems to work quite well. I had a great discussion about this actually with another mold expert, Dr. Laurent Tessier, another naturopathic doctor. That podcast episode has actually been released, and so we talked about binders, and if I'm paraphrasing what she said correctly, we both seem to be of the mind that charcoal is a really good go-to binder. We don't necessarily have to get into the weeds of matching this mycotoxin to this binder in many cases. So those are the general principles I use to treat mold itself. Over and above that, mold can cause so much damage to the body, especially to the mitochondria. So in order to help someone fully recover from mold illness, oftentimes we need to do some mitochondrial rehabilitation. And then over and above that, unfortunately, some folks, and many folks in my experience, actually in my practice, when they've been affected by mold toxicity or mold illness, then they are more susceptible to other things like heavy metal accumulation and methylation cycle issues and chronic infectious microbes coming to the surface, or viruses being reactivated in their body, like Epstein-Barr virus. Had another podcast interview with another, not a mold expert, although she knows about mold too. Her name's Dr. Casey Holland, and she's an expert in Epstein-Barr virus. So we had a nice chat about that, and actually talked quite a bit about molds. And so that episode hasn't launched yet, but it will. So many exciting talks just waiting to be released into the world. So those are my general thoughts those are my general thoughts about treating mold illness / mold toxicity. I hope that gave the asker of the question a good overview of things to consider there. I do get into this in explicit detail in my course, the Overcoming Chronic Illness course. Anyone who signed up for my newsletter has access to the first couple of modules of that for no charge, and you can access the rest of the course for a fee if you're so inclined. I have a whole hour and a half or 2 hour module all about treating mold illness and how more details about my approach with that and whatnot. I will leave it there for now. Thank you for the question. If you, the asker, or anybody else has any questions about this topic or anything else, please post in the comment section below, and I will do my best to get to it as soon as possible.